She just walked up to me and hugged me, and she was crying. And she handed me the sheet of paper that was from one of the kiddos' teachers. And the sheet of paper just talked about how this kiddo's life had totally changed, and they were acting better in school, and their grades were better. And the mom said, hey, you changed their life. That day, my eyes were really opened, and I said to myself, that's what I want to do for the rest of my life. It would be so much easier just to straighten teeth. But when you see the differences, you can't go back. I can do some really great expansion, but if the patient has a tongue tie and still can't breathe through their nose, they're going to come back 3 or 4 years later ready for their phase 2, and it's going to be a train wreck. It isn't just about what we can do. It's such a multifactorial issue, the sleep and the whole airway paradigm. My title is to fix the skeletal abnormality. I'm supposed to help with the growth, so I don't need permission from a physician. I don't need to go rogue and act like I'm treating this kiddo's airway by myself, but I can fix the skeletal aspect of it and work alongside an ENT or a pediatrician or a myofunctional therapist or all of those people in order to get the greatest result that we could get for the kiddo. When we went away from really analyzing skeletal transverse issues, I think it was extremely detrimental to orthodontics. I feel like the vast majority of orthodontists have gone to the no crossbite, no problem evaluation. If you take that patient and you do an expander or you do something to expand that upper arch, if you don't address the lower, you can't get the upper two ideal. I'm doing orthodontics and I'm straightening the teeth and I'm just compensating for the skeletal deficiency. I'm not going to have a big impact on the airway. It's not the taking out the teeth, it's the fact that you weren't addressing the underlying issue. If you're going to take a PAN and a CEF and a PA CEF to really get a true diagnosis of a patient, you can do a CBCT at a way lower dose. If you take time to educate a patient, at the end of the consultation, they tell you what treatment needs to be done. And then those are the patients that go out and tell 10 people about you. There is nothing better than a parent or adult patient coming to you and talking about how their life changed or how their airway changed or sleep changed. When you take a team holistic approach, it is the most rewarding thing that you will ever do in your life.